Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Hi everyone. So I feel like I have more of the same question, but so Dr. Cam isn't around, right?
Not today, unfortunately.
Maybe I still think maybe you guys might have some insight to this. So it seems like my main issue is my neck, and my eyes. So I get eye pressure if I am on my computer longer, or when I hit the 50-minute point, that's when the eye pressure starts. In talking to my vision therapist, she's told me that, trying to bring up those notes quickly, she's told me that my eyes have, trouble focusing, they have trouble with stabilization, fixation instability, which is causing like fatigue in my eyes, mild isophora. Anyhow, so I'm working with the chiropractor who has really been wonderful. He worked out a lot of issues within like the greater or global my body, like hip, shoulder, all this stuff. And so now we're kind of digging in and I'm getting some adjustments in my neck. We were really focusing more so on just the muscular work because I had a lot of tension, and that really, it made me feel like just a million times better I feel like in life in general, walking around, like I feel so much more loose and mobile. And now, yesterday we went in, this will be the second time he's adjusting like C2 and C3 in my neck. And what I told him was last time when I connected with Dr. Cam was like, let's really dig into the neck muscles and kind of recreate the eye pressure. And so he's like, okay, cool. He felt around. There was actually areas in my collarbone that created some eye pressure. And, and then he touched around other areas in my neck. And I was like, well, no, I don't really feel it there. That went on for a few minutes. I guess my question is like, and I don't, I know that Dr. Cam wants the doctor to really, really dig in. Like to a certain level, this doctor is willing to do that. And I've loved working with them. But it does feel like maybe it's me just thinking, because I'm kind of always looking for like, I want to stay on track. Like, what's the next thing we can work on? How much more can we push this? And kind of asking questions like that to him. But it feels like he might feel a little bit like, I don't really know what to do with this. And he's trying based on what I told him. And, like I played a voice note that I recorded from a call, that Dr. Cam kind of directed me, what to do, or the doctor what to do, which was really helpful. But it's like, I can only push someone so far. And I guess my question is, I don't know, like, I talked to him about, potentially trying his acupuncturist, but it wouldn't be really in combination with of course he would inform the doctor what to do after, but the way that Dr. Cam kind of has his process down, and it feels like obviously he's worked with so many of these concussion patients before and he really like knows what to do. And I'm sort of like, okay, do I just keep on pushing him every week? Like, let's find the pressure, like keep on testing it. Like, it's just like, don't know how to make this person or any other doctor kind of get him to need to do what I need him to do.
I think I understand what you're asking, and I think both myself and Melinda could probably give some advice here. First of all, this is a absolutely key question for everybody that's listening. So I hope everyone's paying attention to this really important question. How do you know that the team that you're working with is right for you right now? And the key thing that I always go back to is, are you making some sort of progress with the type of care? Because there's a fine line between always, and it sounds like here that you're being very proactive. You're talking to Dr. Cam about all the different concerns that you have. And there's a fine line between us being impatient with the process and also the provider not knowing what to do next. Because if you've plateaued for, let's say, a month or so, like, because sometimes there's a natural plateau and a progression of a treatment, and that usually the first step is discussing that plateau with your provider. Because if they've demonstrated some good expertise in helping you in the past and have given you some results, maybe it's just that they need to try something else and you need to give them that feedback, or maybe they've reached the end of their capacity. And that usually can be sussed out by the person, by the patient, after about a month of minimal progress, and then bringing that up with them saying, hey, what about this? Because we need to be proactive about our own health, but there is, again, this fine line between trying to be your own doctor and trusting the people that you're with, because it's a double-edged sword. I have some patients that come in and they think they know more than you, and then they already are closed off to the process that they have, and that is an obstacle to care. So Cam is talking to you virtually. He doesn't put his hands on you. So that's a huge disadvantage. So he's giving you just general recommendations. And then it's up to the provider that you're working with. So if they've helped you in the past, give them the benefit of the doubt, have a conversation with them. And if you've brought it up recently with them, give them a couple sessions to try to address some of the things that you've brought up and gauge the impact, gauge the change. And if you continue to get no progress, after about a month of even after bringing it up with them, that's maybe time when you're now seeking out an expert in that field of the exact area that you need. I don't know, Melinda, if you want to add anything from a cycle perspective.
I mean, I think it's tricky because, on this platform, Dr. Cam's giving us some support in the way of what he knows from his practice, and it's broad advice, right? So it doesn't mean that is a fit for everyone. So there are people out there with different types of conditions like hypermobility, or, we talked about Ehlers-Danlos syndrome at one point, where individuals have this sort of sense of hypermobility. And if you have something like that, digging into your muscles and joints is going to be actually unhelpful. So I just wanted to kind of do that bird's eye view again, where it's like, that's his general advice and what he's found from his clinical practice. But that doesn't mean that's a, catch-all for every single persistent concussion symptoms patient, because each individual is so different. So yes, finding a provider that's able to support you in the way you need is really important. And I think, loosely doing that month idea that Paul is suggesting is a great one, right? If you're not noticing any change in a month, maybe that provider just isn't a great match. It's kind of like shopping for a provider, right? You have to kind of work with a few different people to see what sort of change takes effect, and that can take time, right? It's the same thing with seeing a psychotherapist. One of the main things I talk about in every first session with a client is you need to do some shopping. Make sure that your provider feels like a good fit. Of course, it's more for talk therapy and how that person feels about opening up, but it's the same thing with manual therapists. Patients will say, well, if I don't trust them and I'm always kind of tense when I see that person, you're not really going to get any progress with them. So it's the same kind of thing, right? Finding someone that supports you or the style that you are interested in, but also giving that provider the benefit of the doubt to do their gifts and their skill set, because each provider is going to have a different way of going about it. And if we're trying to instruct them on how to do it, it's probably not going to be less effective than if we allowed them to do it their way. And it's sort of just this sense of allowing each provider to have their unique approaches explored. And if it doesn't work for you, then maybe it's time to move on, and that's okay too.
That makes sense. I think it's just obviously it's so frustrating. It's just this. I tried another provider I was with for a while too, and spoke to many chiropractors over the phone over the last several months as well. And I wish there was just someone who knew exactly what to do. You know, the other thing, so I know I need to, so it's not, I feel like I have next steps with this provider. He's been really wonderful, in kind of adjusting for me. Maybe an acupuncturist will help as well. I do know I was really sensitive to some acupuncture sessions I did last year. But that was also when I was highly symptomatic. So I feel like I've calmed down my symptoms. So maybe that was it. I don't know if you have any feedback there.
You can definitely improve in that front where you get less sensitive. It's not ideal that you're going to see an acupuncturist that is not also doing the manual care, because they may not actually be able to pinpoint the area that you're doing. Also, acupuncturists, just from a licensing perspective, generally are trained in what is traditional Asian acupuncture. And that is more meridians and moving chi and addressing a whole different way of thinking about dysfunction, where I think, the Western approach, which is what most physios and chiros do, because they can also get trained in acupuncture, they are now looking at where's the particular muscle trigger point that I can release with this needle, and that's the more kind of approach that Dr. Kam takes. So that's not to say that you wouldn't benefit from traditional Chinese acupuncture, but you definitely wouldn't get the same type of attention to your neck and the particular muscles of the neck that are dysfunctional.
That is so helpful. Thank you so much. That's really helpful. I'll see if I can find someone who does both. When I get there.
Or asking what that provider's training is, right? Maybe they are a physiotherapist with the type of acupuncture training that would be beneficial for you versus a traditional Chinese medicine provider.
It's so hard because in the US, or at least in New York, well, I imagine it's a US thing, but because with insurance, you have these separate treatments you're going to, so everything is applied separately and they treat it separately. So even though he is an acupuncturist in his office, like it's always going to be this separate appointment and charge. But
Yeah.
I'll see if I can. Yeah, I'll.
It's the same in most places. Like what we are like in many ways. I'm looking at the comments here, and in many ways we are looking for like that perfect fit. And you might term that like the unicorn provider, and that can be daunting and frustrating. And you sometimes find that it is something you need to cobble together. And maybe one person ideally would do it all, but most people need multiple types of providers. And I know this is frustrating, but this is something that is the reality of our current Western healthcare system, where it's so kind of siloed. One physiotherapist and one chiropractor can treat very differently. But then at the end of the day, too, we have to realize there are some people that are just incredibly gifted at their craft, and there's some people that are just okay and average. And that's the range that you might experience. It's in naturopathic medicine, it's in psychotherapy. And then finally, I forgot to mention, sometimes it's just the right fit too, as Melinda mentioned. Some people just don't jive and don't have the rapport with other people. But it sounds like you have at least checked that box. You have a good rapport with this provider, and that I think is a really powerful therapeutic thing. And if you can try to really guide them in that way, and you hopefully in the next couple weeks, in the next month, you'll figure out if they're willing to go to that level. But also just guard yourself of not being too hasty to move on and throw out a good therapeutic relationship if you feel like progress is not being made at the pace that you want. So there's this fine line of being also a little bit patient and allowing that provider to work their technique with you.
Yeah, and I've been kind of biting my tongue on this psychological invitation for the last little bit, and I'm thinking maybe now is a good segue to send out the invitation, and not just to yourself, but to everyone here. And that's oftentimes when we get really focused on physical therapy and manual therapy, there's also an underlying need to find an answer that we're really, really focused on. I like there might be thoughts in your mind like, I have to fix this now, or there's a timeline coming up where I need this to be better. So you might kind of just think to yourself, is there a reason that I'm really pushing to get this fixed now? Is there a reason that I'm really pushing to find that answer? Of course, when you're living with PCS, there's suffering day to day, and it can be so challenging to sort of live with that and try to move on with a decent quality of life while you're managing all these uncomfortable symptoms. But one of the things we talk about in the recovery mindset over and over again is if we're rushing the why and we're trying to find the answer and we're really fixated on that, that actually adds to our suffering and can hold us back from finding some of the answers we're looking for. So it's almost like we're looking too hard and we're pushing too hard, and that can be a disadvantage as well. So a little food for thought, see if it fits or doesn't fit. But sometimes that can be a real hang up for people. And something I see really often in my practice is I'm just trying to get back to normal. I'm trying to get back to functioning, and I'm pushing really hard with all my providers and all the people I'm seeing, trying to get there. And when we push too hard, it's actually a disadvantage in our journey. So something to think about.
Yes. Thank you. I appreciate that. Um, that's, yeah, okay. I'm gonna take that into account. The last little thing I have, if it's okay, in thinking about some of what you were mentioning, Dr. Herkel, before, like related to hormones and maybe even adrenal issues. I don't even know if you mentioned that specifically. Um, I'm wondering if I'm getting, so the eye pressure headaches are, they're a little bit fatiguing. So I get to the point, and it might just be an eye, a vision or a neck issue. But so, being on the computer too long and too often throughout the day can be fatiguing, and it'll kind of give me some brain fog. Are there, I'm sure it's all system related, and there are many things that are happening with that, but I'm wondering, my naturopathic doctor at one point had mentioned methylene blue to me to, help with like building new mitochondria. I think that's the way you would say it. I'm not sure. Help with absorption, help with fatigue. Do you think, and I know you mentioned that's not something you necessarily recommend because there aren't enough studies around it yet. But is there something that you recommend in relation to this? And do you think it would help with the eye pressure? Outside of the eye pressure things, like I definitely think there's adrenal related things going on. I'm on some supplements that my naturopathic doctor recommended. But so the question is, A, is there some kind of supplement or something in general that you would recommend that could help this eye pressure fatigue? And then B, in general with fatigue, do you think something maybe different than methylene blue could help with fatigue or adrenal support? That might be too big of a question.
I can answer this question quickly because we have to move on to the next one here. But I think in general, if you have eye fatigue, that generally is related to cognitive processing and some of the inputs that we've already talked about in relation to the neck. So in my experience, adrenal dysfunction or other hormonal issues are not really well connected to that particular symptom. Now, in general, to kind of segue into the mitochondrial conversation, the adrenal system affects the mitochondria very, very profoundly. And so, of course, optimizing that will help with general energy production and mitochondrial function. So it's absolutely going to be helpful. But do I think that taking methylene blue is going to help with the eye pain, eye pressure and eye fatigue? I don't think so. And that's, I think, probably the best way to kind of move forward with that.
Yeah, and then also the piece on stress, right? Reflecting on stress in your life and what kind of pressure you're feeling right now. And I know there's always sort of this, energetic piece we think about too is eye pressure and sort of the pressure on yourself. And that's a
Yeah.
conversation for another day. But just thinking about whether or not there's just a lot going on for you. And if slowing down a little bit and maybe pacing some of these treatments and some of these things might actually help reduce the tension in your body, which can help reduce the eye pressure. There's sort of that link too.
Okay.
Gotcha. Thank you so much. I really appreciate it.
You're welcome.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.